is an impressive woman, the founder and CEO of TEMOS International. Since 2004, she has been working on TEMOS certification system, assessing hospitals, rehabilitation centers, reproductive care centers, and dental clinics worldwide, according to TEMOS Quality for International Patient Management. She has been working with more than 100 hospitals and medical facilities worldwide, from Brazil to Philippines. Also, she developed the Quality International Patient Department process for the Turkish Ministry of Health. Since 2014, she is the vice chairwoman of the Diplomatic Council Healthcare Forum. Please welcome Dr. Claudia Meek.
So thank you very much for the nice introduction. We have been discussing of medical tourism, health tourism on the country basis, governmental basis, the impressive program Egypt is currently preparing. And I would like now to dive a little bit deeper in the practical work of medical tourism and the role of international patient departments in the whole ecosystem of medical tourism. And I'm going to start with a case study. This is a workshop, by the way. It is not a presentation only. So I would like you all to get awake again and help me to do this workshop this hour so that at the end, hopefully we all had fun and learned something. So let's start with a case study. We're talking about Emma. Emma is a 65 years old lady. She loves Egypt for her annual vacation. This year, she decides to combine her holidays with dental treatment in Egypt to fix some issues in her mouth. She does not trust in facilitator services and therefore wants to contact the dental clinics directly. Since she used to work as a secretary, she's confident that her English is sufficient for the communication. After doing some research, she found 5 dental clinics that seems to be suitable for her treatment request. You don't need the chair. You need to read. So case study continued. Emma finds email addresses of all 5 dental clinics, contacts them with the request to get back to her with further information. Clinic 1 does not respond. Clinic 2 sends an automatic response but does not follow up. We heard from Tatiana so that artificial intelligence and chat box are used more and more. So the question is, if we use it, we have to be very careful. Clinic 3 responds within 1 hour but in Arabic. Clinic 4 responds within 1 hour in English and offers a first get-to-know online meeting for the next day. Clinic 5 responds after 72 hours in English and offers a first get-to-know online meeting for the next week. What did Emma do? Which clinic did she continue? And why? I don't have the answer on the next slide. The answer we discuss. Okay, so who is for Clinic 4? Yeah. If I were Emma, I would also choose Clinic 4. Why? Because this clinic responds in a language she understands, in time. This clinic has competition, and clinics who are involved in medical tourism, they know that they have competition. So they have to respond fast, in time, in a language understood by the patient, and to continue to offer her an online meeting to build trust. So therefore, yes, I agree with you. I would also go for Clinic 4. Why do we need an international patient department or an international office or however you want to call it? I give you a few points and then you add. It's only costly. Why should I invest in my international patient department? You present it to me, you only want money. That's often heard. Second, where is the return of invest? So if I invest in your department, when do I get it back? How many patients do we get? So the financial director then will calculate, okay, patient, okay. So this is something in the negative. Do you have some positive points? Why? For what it is good? Talking about Emma or thinking about Emma. Who would respond to Emma? If not the international office, the call center in Arabic? Please, Dr. Zainab. Yeah, we don't have another. Can we have a second microphone, please?
Well, thank you for the lovely presentations, everyone. But I would like to emphasize we need international patient departments. Actually, I didn't know that we really would need it so much until I tried it personally. You need somebody who is well trained, qualified, able to respond to patients with different cultures, different requirements, insurance companies, assistant parties, um, people's families sometimes. You need to talk to embassies, you need to coordinate many important issues like transportation, ambulance transfer. Maybe sometimes you need to coordinate patient files to send to doctors abroad for follow-up. You would need to get different types of medication, maybe sometimes even by DHL. So this coordination is of a specific type. Sometimes very other non-medical issues like certain types of food, certain types of needs for a patient who can't needs help translator to talk to him with medical background. So actually the international patient department is a very pivotal role for institution who is going to and maybe even before it starts. I mean, even if you say it costs money, this money you will lose the money and reputation if you don't have a competent international patient department. It doesn't have to be many people, but you must have people who follow the standards properly and understand what and why and how they are going to work beforehand, I suppose.
Super. Thank you very much. Perfect. Yeah. A contact point for international patients. That's what Dr. Zainab said is one point. And Emma needed a contact. Another point is the coordination of clinical and not clinical services. Before travel, Emma has not even started her travel. She is organizing her summer holiday and wants to fix her teeth during her summer holiday. So before travel, very important. And the example Emma shows us, if you don't respond in time as an international patient department or the responsible, then you will lose the patient. You have lost the patient before you even gain the patient. On site, this is, of course, mainly medical treatment, but the international patient department is accompanying, is visiting the patient every day, asking about any needs. So that's, and then post-discharge and follow-up. We saw in the presentation before this cycle of the international patient. And once the international patient has left your organization, it's not done. There's follow-up needed. You need to ensure that the patient is safe even once he or she has traveled back home. And in case it is an implant, for example, we as an accreditation body even ask you to follow up depending on the manufacturer's advice for the implant for the new hip or new knee, 6 or 9 months or even 12 months. So this is all services. Mainly all of them are non-clinical, but which are very important to give the patient experience the best opportunity to develop. And don't forget, an international patient department represents your organization inside and also outside. So it can be a very valuable support for the brand and the reputation of an organization if it's done well. Because then it is spread internationally by the international patients that the organization is doing a good job. Anything else you want to add from your experience? Dr. Zainab already added a lot of points to my list. Again, this is a workshop. I only give some points and the rest is up to you. Any other point? Dr. Karim?
Well, first of all, thank you, Dr. Claudia. Since we started the IPD, the International Patient Department for Medical Tourism in EgyptAir Hospital, which started just last year, we've noticed the importance of the IPD. I've been honored to be the head of the department, and since then we've been receiving, in Egypt in general, we've been receiving lots of foreign patients, but how to deal with the patient, cultural differences, and the cultural sensitivity issues, which is tackled in many of the accreditation, especially TEMOS. We've learned a lot from it on how to deal with those patients, how to feel for the patient, because he's coming to a foreign country, getting treatment among people he doesn't know. Most of the time they don't have their families, or maybe one that accompany him. So I think the IPD has made a lot of difference in the same patients that we've been seeing before and we're seeing again now. The same patient has a different perspective to the same hospital, because now there is an international patient department which helps and facilitates to evaluate the case before travel with the doctors, and facilitate the cost and the estimate cost of treatment, so that the patient, before they travel from their countries coming to get treatment, they know exactly, or a round figure of how it's going to be paid and how much it will cost on site. And in EgyptAir we're a little bit different, because we help with flight tickets, with accommodation. We receive the patients literally from door to door, so from their door at home to our hospital and back to their place, and then we follow up. So what I'm trying to share here is the same patient who came to EgyptAir Hospital as a foreigner a few years ago has a different experience today, having an international patient department in the hospital. There are many things that I can say about the benefits of IPD, but I will be too biased and not leave enough time for you to continue. So please, thank you very much.
Thank you. Okay, so then let's continue and see, because you also mentioned a few other points where we come. Somebody again put the chair there. That's another chair. Could we remove the other chair, because it's a little bit unfortunate. So the dots you answered. What are the tasks of the International Patient Department? And Dr. Karim mentioned already a few of them. So it's the timely response to requests. It's crucial. It is, and Dr. Karim just mentioned it, could be booking of flights. And here at EgyptAir Hospital, the example, Dr. King, we have the ideal basis for that, because we are linked to EgyptAir. So this is the ideal model we can have. Could be arrangement of accommodation for patients and relatives. We have organizations like dental, or if we talk about cancer treatment, then patients may come only for outpatient treatment, and they're going to stay at a hotel. And then they need to have not only the transportation, but also the hotel and accommodation. Transportation services to and from the airport and to the clinic and the hospital, and the coordination of medical appointments. These are, again, only a few examples. So what else is the International Patient Department responsible for? From your own experience, or from your thoughts, what do you think should be done? We heard, yeah, Dr. Nagla, and then where do we have the microphone?
I think it's important, the case manager. This from entering the hospital admission, self-charge, especially for international patients, need supervision and coordination of all medical specialties I think because the difference of the language and the culture, I think it's more important to have a case manager. I'm trying actually to put this as new requirement and new position in the hospital. Actually.
Super. Yeah, good, good. We come to this point also again. Yeah. Okay, Dr. Nagla, Dr. Nagla, and then I go back.
Okay, Dr. Claudia, I think he's playing a big crucial role in assurance of the patient and making his experience and his journey inside the hospital more safe, more psychological stability, because the patient needs someone to be assured to represent himself and the complaint and what he needs and what he feels. IBD ensuring this issue by a translator or by a good communication and by solving the problem. So if we have a good IBD in the hospital, I think it will be very competitive advantage and adding value for any organization working in it.
Super. Thank you very much. I bring the micro to you.
I would like to take the scale of the international patient department into the governmental level, because this is what we, that was the concept that we built the unit of medical tourism at the Ministry of Health under supervision of Dr. Salim Khan. I'm honored to be the head of this office in the Ministry of Health, and that's the idea of collaboration between all the Egyptian authorities, not only the Ministry of Health, also the Ministry of Tourism and the Foreign Affairs and anyone related to the process at any phase. And we also made like there will be a complaint center to under the supervision of this department of the Ministry of Health. So at any phase, if any problem happens, even if he's still in his country and having a visa issues or whatever, we can help and assist. He had a problem in the airline ticketing or the booking, or he had a problem when he arrived at the airport. So we are involved in this. We are responsible in this patient. He's in a bubble under the governance of the Egyptian government, and this is the idea of the department, that we have one place to complain in, and we have the rule to solve the problem at any phase or any place. So I think it's not only important for the for us to monitor the process, but it's also convenient for the patient to have like one place to seek help from. And this is the main idea about this sector, the newly generated sector in the Ministry of Health.
Thank you for sharing, and I think this it confirms, or is already confirmed as the best practical example from the Emirates. So we heard it from Mrs. Lidar, so that they already did it, and she could only present good things. So if Egypt is going in the same direction, it definitely makes not only sense, but it is very good for all the patients that are coming. So thank you for sharing that. Okay. Who should be member of the team? We had the case manager. I have some examples here. Nursing, physician, accounting, administration, liaison, insurance, hospitality. So administration for me is somehow the case manager. It's exactly, that would be my suggestion. It's not limited to these people, and not necessarily all of these professions must be represented, but this is an idea if you want to build up an international patient department. So we need, of course, nursing and physician contribution, because the international patient department itself is rather a non-clinical department. Although we have doctors available who do the job, as you said, case manager, there is a lot of medical knowledge needed, but supported all these non-clinical services, transportation, accommodation, arrangement within the clinic. This is non-clinical. So it is a multidisciplinary team, ideally, who works very closely together to support each other to give the best to the patient. Anything I miss here on my list from your experience? Yeah, a mixed one. That's why I said somehow you can call it differently, a case manager, administration, insurance liaison, but that's in case the positions or the professional feedback. Okay. International patient services, where are they? And we talked about multicultural, cultural sensitivity to be multicultural. But international patient services, it is not orthopedics, it's not the nursing department, it's not the kitchen, it's new. What is it? So what is the position? In addition to serving the patient, international patient services are the link to the different hospital units and departments, clinical and non-clinical. So if we have a patient with multimorbidities, then he may need to go to different consultants from radiology, laboratory, seeing internal medicine, and then going for orthopedic surgery or whatever. So, and the international patient services may be the link to interface between all the units to arrange smoothly the journey of the international patient. So this is one part. The international patient department is the patient contact point. And in some cases, and I think those of you who are involved in IPD services, they are at some stage maybe becoming friends. And you will get letters afterwards, thank you letters. They send you a birthday card or send you a picture from the wedding or whatever. So that's also international patients. It's rewarding because if they have a good experience, and we heard that before, that no patient, and I want to make it very clear, no patient loves to travel to another country to receive treatment. We are all humans. Think about yourself. Would this be your number one priority, to go to another country? You don't know the healthcare system, you don't know people, you don't know everybody. To go and just get treatment, this is not fun in the first. And we are all humans. So we have good reasons, and we heard this morning about the reasons why people travel, or must travel, or want to travel because they don't have the money that they can afford in their own country. So this means if you give those patients a hand and a good experience, they are very thankful. And we see that in the surveys of between national patients, domestic patients, and international patients. In most of the hospitals and clinics, the feedback is much better from international patients because they're very thankful. If you take their hand, give them peace of mind, and smoothly run them through the process. So therefore, I mean it. They are friendships. We know that from all over the world. They are friends afterwards, which is very nice and rewarding. So it's the contact first, it's the contact point. It may be a friend, a surrogate family while abroad and after return. It's an interface between the international patient and the hospital and clinic. So it's not only the first contact point, but it's also when something has to be arranged during the treatment. Hey, IPD, I don't feel well, but I can't tell the nurse because the nurse in the night shift doesn't speak my language. Can you help me? So it's an interface between the patient and the hospital. What else? What did I miss? Anything you want to add? Take my mic.
My name is Shams. I think that the IPD has a very important role in training the personnel in the hospital about their experience with the patients, because in some instances the hospital employees are not well oriented by the cultural aspects and the medical aspects of the patient. So they are the bridge or the delegate to train the other personnel in the hospital. I think that is
excellent point. Absolutely correct. And by this, we can also refer then again to the interface between also the training department, offering as international patient partners training to colleagues, and doing it. Absolutely. And first of all, being trained itself as a department, sure, so that they can forward this. Absolutely. Very good. Any other point you would like to add here?
It's also really important with the follow-up afterwards that you were discussing, and not just are you okay, but if the patient reaches out needing assistance documents that perhaps was lost in the future. I know I've done that, and being available quick to respond, like that you still matter even after your surgery, after you've made your money, after they've made the money, after you've gone home, that they still feel that they're part of that team that they met when they were there, and they're just as important then as they were before the surgery.
Yeah, very well point. Thank you. Anybody else who wants to? Yes, Dr. Mina, please.
Thank you. I guess the international patient member should have a very important and crucial factor, which is uh, they should have emotional intelligence because, as you mentioned, that it's difficult time. No one wants to travel for treatment, so really it's difficult situation. So they should have like emotionally intelligence how to reach to the patient, to the client, to contain this difficult situation. So,
Absolutely. Yeah. So we could add, you said emotional intelligence, empathy. Empathy is then another word as a social a skill to have. Yeah. Very good. Thank you.
Maybe I can say that international patient officers, they are kind of soldiers that are fighting a war and keep the patients behind safe for coordination between all departments around the hospital, all the complicated issues that may rise. Actually, me as a quality member, I can say that international patient department raise many small issues in quality and processes inside the hospital as they they go deep in these processes before going to the patient, to the face of the patient. So it's a very very important thing.
Great. And I'm happy to hear that cooperation between International Patient Department and Quality is so close. Excellent. Oh, gone. Here we are. Did I miss something? No. Good. So what is the role of the governing body, the top management? Also a question we are asked in between. I have a few points which I like to contribute, and then I would like to give the floor to you. IPD services should be part of the strategic planning. It could be an own business unit, ideally, and therefore it should be part of the strategic plan with all the points which are to be discussed in the strategic plan for the different business units. We already recommend that the reporting structure is directly to the top management. So if you see in the organigram, we would like to position the International Patient Department as an important part with respective reporting structure. What else? The link between governing body or top management and international patient services.
I think it's very much related to the strategic planning from the governance point of view, and the sustainability and the social responsibility of the hospital facility towards the community and the international patients. So it's very strategic in nature, and not the on the operational level. Maybe for the funding even, or isolating it as a business unit, as a revenue generating unit rather than cost.
I agree. That reflects the points I mentioned. Other points you would like to add here, Dr. Nagler?
I think leadership and the governing body is very important in managing and leading all the organization, especially the IPD. commitment of leadership towards the medical tourism and the passion for continuing to have more customer and more improving in the hospital. Encourage the IBD to do their work. Much appreciation for their work, supporting them, providing what they need. All the time they are follow up their work, and they do a little bit realize about if they have something not very good, and if they have something good, they do they celebrate their success to insist all the employee in the IBD to do more. I think it is very important for leadership to do this.
Yeah. Yeah, and we unfortunately see, and this is why I added this slide for today, that we sometimes see that international patient departments don't get the attention they require or they deserve. Those of you who are quality people and are familiar with international accreditation systems, you may know that international patient departments are never asked by our international accreditation bodies colleagues. It's completely ignored, but it's part of the hospital, and not only from the financial, from the business perspective, from patient safety perspective. I mean, we have to include them for patient safety related topics and for all the topics. So therefore, it's really worth that the international patient department is closely linked to the leadership and governance, and as accordingly also, if this is wished by an organization, to be put in the strategic planning. Is there additional budget needed? We talked about leadership, governance, and now let's talk about the financial director. And for what? Again, I put a few points. The contact and realization of cross-border continuum of care. This is the main work of the International Patient Department. And we need human resources, and human resources need to be paid. And therefore, this budget for human resources is definitely needed. If we go further and say the International Patient Department is also representing the hospital or clinic, could be on fairs, exhibitions, in conferences, then there may be budget needed for travel, for marketing stuff to present the organization. Marketing and communication itself then also continued in social media activities. If you do something good, talk about it. Social media, I know here in Egypt, you're all social media addicted. So that's something. But this is how it works nowadays. So who is reading, is opening a brochure? Unfortunately, nobody. We need a 30-second video. We need this and this and that. Like me, I'm old-fashioned. I still read a book. I mean, a book with pages you can change. But I'm thinking I'm the species which is not existing in the near future anymore with this. So marketing and communication, this is how it works. And competition is there. Being honest, and we have to differentiate ourselves. This can be done via the International Patient Department services as one option. What else? From your experience, for what is budget needed? I give my micro again. You have, okay, then we start, and then we have the governmental perspective as well.
I think language needs more budget for the staff and the IPD itself, and foster the language barrier. We have to know our target IPD, international patients. So I think it needs budget for training and foster the language too.
Yeah. Okay. So yeah, language training. Yeah. Here in Egypt, you are quite fortunate and privileged because you speak Arabic and you speak English. In the Emirates, it's the same. Dubai, Abu Dhabi, they speak both languages. If we go to Turkey, then it's an issue already. We do our assessments in Turkey with translation, so this applies also for the patient, so that's definitely a valid point. Dr. Nagler, budget for what?
Budget for technology. They need computers, they need supplements for doing even fund for the customer, mobile phone, tablet or something like to easily communicate, good internet connection, good program for connecting the patient, and secured one, how they can provide secure the communication between the patient and the IBD during the stay and after and follow up. This is, I think.
And you just mentioned communication and IT, and this means also to assure via the IPD that the patient can communicate with the families at home while they are staying abroad, so that an internet connection is there, so that they can have Zoom, Teams, whatever meetings, WhatsApp meetings with the beloved ones at home to exchange because they are concerned at home, and so that they can follow, accompany the progress. Yeah, it's a good point. Please.
Actually, yeah, they covered most of the points that I wanted to say. The training and the experience exchange that the team working in the international department have to be involved in other systems and the know-how of the new or the better systems that we are looking forward to be like them and to be as in a competition with them. So I think also the exchange and the training is important, and also the more we increase the services that we give to the international patients and giving them better experience, and that needs like more cost every once in a while, that's also like going to build a loyalty system with this patient and very good reputation, like he's coming every time and finding new things that will make him more impressed and want to come again and again. So I think that's really important.
Thank you. So it's worth to invest in the IPD. There's something coming back from it, I see. Anything else you want to contribute regarding the budget? Yeah, so I take the, please.
I think the budget for the talent acquisition of the IPD department members, maybe we have to be having some criteria of dealing with the patients concerning the language barriers, the cultural barriers. So I think this is a high skill increase and must be having a good budget for them.
Yeah, you're right, and it's high skilled, and if we combine the empathy, languages, and these basic knowledge about hospital environments, so it doesn't make, I mean, if you're coming from a travel agency and now starting to work in a hospital in the IPD, you can definitely contribute from your experience, but what you miss is, and where you need training, and that's where we confirm again that training and education is needed, you miss the special environment of the hospital or the clinic, and this is very important to know what to answer if the international patient is asking for it. Yeah.
We'll be having a blend of knowledge, medical, cultural.
Yeah. Therefore, you're absolutely right. It's high-skilled people, and if they have good skills, high skill, then they will ask for money accordingly, and they deserve it.
Yeah, true.
True. Okay. So to summarize, what is crucial role of the International Patient Department in medical tourism? What we need to achieve, and I think this is obvious from what you said, is that we want to have the peace of mind for the patient and his or her relatives. Either if the relatives are accompanying, traveling, or if they are staying at home, so that communication is there. But peace of mind, package models, with the respective skills, as we said, in training and education. I think this was one of the main points and the crucial role of the international patient services. A second point we mentioned is the representation. Don't underestimate the role of the international patient department to represent and to build, to contribute to the building of the reputation, or to keeping, maintaining, or increasing reputation, and what we call nowadays in marketing the branding. And international patient department represent a hospital. A hospital represents the region. The region represents, in the end, is represented by a whole country. So we are not talking about only one international patient department. We are talking about the big picture of it. And therefore, it's important that the government has the clear structure and plans. And then this is, the contribution is coming from all the service providers. Timely response. Emma chose Clinic 4 because of the timely response, because of the cultural sensitive communication with her. She got an answer in English, and she was offered a call, a meeting the next day to build the trust. So these are some points in the direction representation, reputation. Return of invest. We all know medicine is a business, if we want it or not. And therefore, we know from successful international patient departments that there is not only return of invest, it's really a cash cow. I know that international patient directors tell me, Claudia, I made millions for my hospital, and I'm number one income in my hospital. And this is why I ask for more budget, and this is why I'll do this and this and that. And this is why I request international accreditation for my services, why I go for this, to increase. And yes, it is a cash cow. Talking in business, it's a cash cow. It can be a cash cow. And it is support of the country's medical tourism strategy. So that's what we just discussed. It's important. Don't think only for your own organization. It will not work. If you're the only hospital with an international patient department in your country, it will not work. We heard a lot of other factors. What is important to promote medical tourism? Like that the country is safe, that it is stable. In Egypt, we have the advantage that you are very well known for tourism. Now you add medical tourism. These are all factors which cannot be seen separated from each other. But the international patient department we are talking about today is one piece of the puzzle, and the puzzle must be complete. Then the country's vision can be reached and the strategy can be achieved. So don't forget that it's the country's medical tourism strategy which is supported. I see a lot of people joining now. You missed the workshop, but I'm sure you're coming for something good. So therefore, I would like to close my workshop, just offering you, if you have any questions now. Of course, formally, we have 12 minutes, 50 seconds to continue this workshop. And you also see my contact details here. I have my card. You know how to reach me. But of course, the floor is open for your questions and further comments.
Any questions for Dr. Claudia?
Thanks, Dr. Claudia, regarding this presentation. I think also, Dr. Claudia, regarding the sustainability in healthcare services is very important also, and maybe international patient department initiator for this and catch or search about this, because as you know, the cost of calls is one of the main aim for the hospital board and other governments also. So I think this is a very important also. Thank you.
Thank you very much. I know that specifically the example for EgyptAir Hospital, the quality department is the initiator, but since quality and international patient department are working closely together, so yeah, a valid point. Thank you. I think we have to call it a day because all these people are waiting for something which I don't know, but I'm sure they're not coming because of me. So there's another lecture. Okay, so therefore, welcome to the others, and thank you very much for staying with me and discussing that today.